Hi, everyone. Welcome to our webinar on community well-being. My name is Alan McKee. I'm the communication specialist for CANU, which is the Canadian Urban Environmental Health Research Consortium. I wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. Before we get started, I would like to remind you to please turn your cameras off and stay on mute during the webinar. If you have questions for our speaker, please put them in the chat and we'll have time at the end of the webinar to answer them. Now, it's my pleasure to introduce Antonio Gomez-Palacio, our speaker today. Antonio is an urban planner and founding partner with DIALOG, which is one of Canada's leading design firms. His professional experience and research focuses on the intersection of architecture, planning, and urban design. He's internationally recognized for transforming cities into vibrant urban spaces that respond to their social, economic, and environmental contexts. Antonio has worked on a wide range of projects focused on urban intensification, master planning, mixed use, transit, heritage, economic development, and sustainability. His project work includes light rail transit projects for Mississauga, Brampton, and Edmonton, downtown plans for Halifax and Regina, and campus plans for Seneca College and Laurentian University. In addition to impacting communities through his professional practice, Antonio has acted as chair of the Toronto Society of Architects and the City of Vaughan's Design Review Panel. He's involved with several industry initiatives and organizations, including the Canadian Institute of Planners, the Royal Architectural Institute of Canada, and the Canadian Urban Transit Association. He's a member of the Planning Research Advisory Committee with CANU and the Rethinking Rental Roundtable with Canada Mortgage and Housing Corporation. Antonio is also the chair of DIALOG's Community Wellbeing Framework Roundtable, which launched in January 2021. So we are very lucky that Antonio is able to take time out of his busy schedule to speak with us today. Thank you very much, Antonio, for being here, and I will turn it over to you.
Thank you very much, Alan. And I'll share a screen in a second, but I also want to start by acknowledging that I actually come and grew up in the traditional lands of the Masawa and the Nawa people, from whom I learned a lot. And today I actually live and work and spend time in lands where shared with a number of Indigenous communities. And I'm extremely privileged by being able to do that. But the conversation today, and where I'm hoping that we can spend a little bit of time, and I'll do a bit of a presentation, but then I'll open it up for some questions and comments and any engagement that people may want to have, is very much around the intersection around ideas of community well-being and ideas of the built environment. And certainly, while this is a conversation that has been taking place for a long time, there's some lessons learned that emerged from the pandemic that have allowed us to kind of continue thinking and continue learning in many regards. So this is where we can spend a little bit of time and see what you think. But I actually want to start by showing you a photograph of my great-grandmother. Partially, I just think it's an awesome photograph. But this was taken exactly 100 years ago. And think about 100 years ago, we were actually going through a world pandemic. But the circumstances were very different. And let's think a little bit about how and where. This is my grandmother. This is my mom. All of them lived and grew up in Mexico City. And this is Mexico City 100 years ago. Today, I live in Toronto. And this is what Toronto looked like 100 years ago in the middle of that pandemic. But 100 years ago, if we were to die, if I was to die, in all likelihood, the 10 top causes of death would have all been infectious diseases. It wasn't just the pandemic. You would have died from a bug that you picked up somewhere. Today, despite the pandemic, the 10 top causes of death continue to be chronic diseases. So instead of a bug that you would pick up somewhere, these are in fact aspects that are related to our lifestyle choices. Do I exercise or not? What do I eat? Do I smoke? Where do I live? the environments I inhabit. All of these things start to matter. So, even as today, and I check the numbers, tragic, 37,000 plus deaths of coronavirus in Canada as of this morning from the pandemic, right? From the pandemic from 100 years ago, it was 55,000. So it's still a larger number with a smaller population. But if I simply take those folks who in Canada are dying from, a couple of chronic diseases, the number is still staggering. So absolutely, we need to understand how do we fend off the coronavirus, but we still need to keep our eye on the ball around many of the other aspects that are affecting our day-to-day life and the well-being of communities. Start to think about not just deaths, but even premature deaths, those elements that are taking folks away early in their life. It is still the case that 60% of premature deaths are entirely related to social and environmental circumstances. Only 30% is genetics, dispositions, and only 10% is actual healthcare that we provide. However, 96% of all of our resources go to the healthcare side of things. Only 4% are on the preventative side, on trying to enable people to lead lifestyles that reduce the incidence of extreme chronic diseases or other elements. So in my mind, there's an opportunity here. There's an opportunity for us to really have a serious conversation around what actually contributes to our well-being, and then potentially start to reorient how we think about environments, how we think about built form, but also how we think about how we organize ourselves as a society and where do we actually invest public resources. Think about it. If I was to ask you which is the apple that you would want to eat, it would be very clear. You undoubtedly would pick the apple on the left. We have millions of years of genetic material that allows us to understand which is the apple that contributes to our health and well-being. But if I was to ask you which of these environments contributes to your health and well-being, maybe you'll answer it's the one on the left. Yet it's the one on the right that we keep on building. We keep on building in every one of our cities environments that look like the environment on the right-hand side. We're actually building cities of rotten apples, right? So there's a gap of knowledge and understanding somewhere along the line as to what exactly are the environments that allow us to lead lifestyles and influence communities in a way that actually contribute to their health and well-being. And it's not just us, of course, it's also the planet. I try to track, where I am today and where maybe some of you are joining in. But clearly we've already surpassed in the way that we consume resources in the planet, the ability for the planet to actually replenish itself. The impact that we're having is greater at a global scale. And this is compounded by the fact that world populations continue to increase. And it's a problem of cities. We've surpassed the moment when the majority of the world population actually lives in urban environments. The good news story here is it's also cities can be part of the solution. Cities can be part of how we answer and address some of these global issues. And pick any health indicator that you like, in this case, childhood obesity. Every demographic that you start to track, we're actually increasing the incidence of childhood obesity. Not unsurprisingly, the impact of global food prices is constituting a greater proportion of household incomes. And this continues to increase and increase. And look at some of the urban context environments that we're looking at, right? So peak congestion in every urban scale is increasing, but so is the number of extreme weather events. Am I painting an apocalyptic picture? In some regards, yes. But the good news is there's also a light in the end of the tunnel that we'll spend the majority of the time today. But lastly, I'll also mention that the global world refugees continue to increase. And certainly we see in the news a lot of them coming from war-torn type of an environments. But in fact, the greatest displacement of population continues to be from an environmental crisis. There are places that are wrought with droughts and famines and such. So, but I mentioned that in this perception of the end of the world, there is some hope, right? There are things that we can start to think about. And my hope is that little smoker at the end of on the screen on your right and the bottom left-hand side of your screen. And I'll tell you why. The focus of much of what we can do is not actually in that immediate response, because there's a huge emphasis still needed for first responders. And they will always be a huge part of anything that we're doing. The bigger response that we as urbanists, as urban planners, as architects, as engineers can have is in that post-vaccine environment where we can really think about the long term. But back to my little smoker in the bottom left-hand corner. With smoking, we've been able to establish a causal relationship between a behavior and a health outcome. As soon as that was established, it was very easy and straightforward to now start to orient public resources and funding and advocacy and awareness campaigns and all of those kinds of things. The next one in this regard is, of course, sedentary behaviors, right, and lifestyles. This correlates to a whole series of health outcomes. And we already have a tremendous amount of literature and understanding that are trying to encourage you to go out and exercise more. And as a result, in cities, we're building bike lanes and we're doing all of these kinds of things. But if this was all there was, right, the link between physical health and physical activity, if well-being was only about this, we wouldn't need to do much more. There's already a lot of understanding here. But I'll invite you to start to think about aspects such as mental health and social well-being and the well-being of a community as a whole. In these regards, we're only really scratching the surface. So now think about it in economic terms. The cost of just physical inactivity in Canada is now quickly surpassing the $10 billion. This is almost 5% of just our healthcare budgets. And healthcare is a huge, the largest proportion of provincial budgets. And that one continues to increase year and year and year after year. But this is not the first time, of course, that there's a conceptual link between ideas of well-being and ideas of how we plan cities. You know, in this depiction of Charles Dickens' era, there was already an idea that downtowns and urban environments were unhealthy, and hence the flight to the garden cities and all kinds of other movements. And certainly the emergence of a strong public health type sector that was starting to address aspects of public health, linking them back to urban planning and city building. And certainly the United Nations and a number of different organizations are spending a lot of time linking aspects of community well-being and how people live. And United Nations is working very strongly on environments that are more on the development side and looking at things like access to water and sewer and very basic type elements. But I'd venture to imagine that many of the folks who are on the virtual call today, these aren't the environments that they're working in. We need to kind of be thinking about how does this apply and how does this thinking apply to the environments where we are spending time in. City of Vancouver, if you haven't seen their vital signs report, it's a fascinating report. They actually go out and track a whole series of things from a well-being perspective that are also really interesting and fascinating. But they're looking at things that as a city builder, as an urban planner, I might not be looking at ordinarily, like voter turnout rates or high school dropout rates. Really critical to well-being, but not necessarily something that I can deal with on a day-to-day basis. I will point to one which is really interesting. You'll see at the little icon on the left-hand side, which is sense of belonging. They actually go out and track at a citywide level, what's your sense of belonging and how is that increasing or decreasing? And how can we really start to think about that at a community level? There's many aspects like this that the conceptual link between the mental health, the social well-being is starting to really tie back into aspects of how we plan and build cities. Of course, there's many other projects and examples. Pearson Dogwood in Vancouver is another example where they came up with their own metrics and how to understand it. But I'm sure you're all now familiar with projects where this is bubbling up as a really important consideration. And in fact, if I simply track how many times there's a link between aspects of well-being and an understanding of the built environment in published articles and citations and in projects, there's a significant increase in this regard. So clearly we are in a moment in time when there's a sense of urgency, but there's also a sense of a growing discourse around an understanding of this. But yet, as my opening slides suggest, we still inhabit a little bit of this cognitive dissonance. We know there's a link, we know there's a problem, it's a global scale problem, but we don't have the tools, the resources, the methodologies to make the leap in our day-to-day work, and therefore we tend to ignore it, right? Climate change is a perfect example. It's there, it's present, but many folks may not see in their day-to-day practices a way in which they can actually make a positive contribution. Similar thing happens with well-being. And this is very much reflected in how we invest in our own social well-being. Think about it, it's easier to invest when somebody is already having a heart attack than the 50 years before the heart attack. So we're spending all of our resources, that 96%, in the reactive mode and very little in the proactive mode, in really trying to understand how do we catch these things upstream and really contribute to well-being by keeping people healthy as opposed to only dealing when a crisis has emerged. But that's our challenge. That, I think, is also our huge opportunity. It's the opportunity for folks who are around the virtual screen today to really start to think about how, in my day-to-day practice and the work that I do and the things that I'm inhabiting on a regular basis, how can I actually make a contribution in that upstream, in that early phases, when I'm really contributing to sustaining the well-being of communities. That was very much DIALOG, the company of which I am part of, the realization that we came to many years ago. And this is our vision statement, that in fact, what we get up in the morning for and what keeps us doing this is a sense that we can contribute to the well-being of communities. But one of the things that we realized is, if this is our aspiration, we truly need to be able to understand, how are we going to deliver this? How are we going to know that we're doing this? And how are we actually going to be able to measure the impact in a positive way and bring some evidence into the design and the decision-making process? So for that effect, we teamed up with a whole series of organizations, the Conference Board of Canada, but series, the Center for Research on Disabilities, ARIDO, a number of different organizations, and launched a fairly large-scale research project that started with really a huge literature review. There's over 3,000 pieces of literature and a whole series of interviews. We talked to city officials and municipal staff and builders and chief medical officers and all of these, to really strike to understand what was the strength of the understanding and where are some of the areas where we could collectively add value. And one of the things that we realized was there's a lot of information if you're a chief medical officer. right? Childhood obesity, like how do you start to address some of these elements? But there, in fact, there's very little information if you're an architect, an urban planner, an urban designer, a community who's trying to figure out how do you design your local park, right? A condo board who's trying to figure out how do they make improvements into a residential building. As city builders, there's very little information that allows you to make that link in a direct way. So what most people are doing is, they search on the web and they try and download a couple of articles and they say, okay, I need to get people to be more active, and you build a couple of bike lanes and you call it a day. So there was a real need to be able to add some knowledge around some of these disciplines. There's also tons of information at a national scale, right? Or at an individual scale. But there's not that much information or knowledge developed at a building site level, at an individual structure, or at a neighborhood level, at a neighborhood park level. Census Canada collects information at a census tract level, but that is aggregating a whole bunch of different sites. And then a lot of the knowledge and the bases are aggregated in scales that are not necessarily commensurable to the way in which many projects, city building projects, take place. So those were two really important gaps that needed to be filled out. Huge part of the research and the development of the understanding started with simply understanding what was the definition of community well-being that made sense, that we could adopt. And this is the one that we ended up working with. Importantly, this is one that has been now picked up by a whole series of different organizations. New Zealand, for example, uses this at a federal level. So big policies that come to federal government are actually tested against this definition. And I'll draw attention in it for a couple of things for you. You're all familiar with the sustainability triple bottom line: environmental, social, economic. Sometimes they'll throw cultural in there. But this definition actually throws the word political in there. And what that means is the voices who participate matter. Who's sitting around the table matters. This is so important that it's actually emphasized in the second part of the definition. Individuals and communities need to be part of this conversation. As soon as we adopted this definition, it was a watershed moment, because it implies that how we would approach concepts of well-being could no longer be about establishing standards or guidelines or kind of fixed goalposts. It meant that it had to be more about how do we inform a conversation at a community level? How do we bring some evidence and knowledge to the kitchen table, right? How do we actually enable communities and stakeholders and professionals and everybody else to think through these problems with a robust understanding and knowledge that informs this exercise? So it was really important that it all of a sudden became more about guiding the process, the design process and the planning process, as opposed to prescribing the outcomes. So we had a definition. Woohoo! We had 5 domains. The next exercise was really to start to develop a series of indicators that would allow an approach and an early diagnostic around what are the existing conditions and how is an emerging plan or design, or what are some of the important conversations that need to be hosted at that community level. So for every one of those domains, there's a series of indicators, and eventually there's actually some metrics that were developed to really start to inform the conversation. And what I'd like to do right now is actually walk you through the 18 indicators, not the metrics, but the indicators. So you get a little bit of a flavor of how the connection between well-being and the design and the planning and the operating of the built environment might be informed. So the first domain is the social domain. And one of the indicators there is welcoming. And you'll notice that every one of these indicators is phrased as a question. Again, really important that it's a question posed to communities, to design professionals, to groups that are trying to think these things through. So the first indicator is about welcoming. Do we in fact have and creating environments that are welcoming to everybody, regardless of background, of physical ability, of all of these environments? And are we asking this question right at the beginning of the project? And it's surprising how many projects don't ask this question, or they ask it all the way at the very end. But unless we're asking it right at the very beginning, and we develop an understanding of what's the diversity of the community that is being served, who are all the folks who are coming to this particular environment, then we'll never be able to really create environments that are welcoming and certainly not contribute to the well-being of the community. Second question is support systems. Do people have access to the support systems that they need on a day-to-day basis? And in some environments, it will be access to childcare, or access to healthy food, or access to healthcare facilities, right? Everyone will be slightly different. But we need to be asking this question right at the beginning. In this project, in this context, what are the support systems that people need in order to undertake their activities of everyday life? Third one is socialization. And, I always knew socialization was an important element, but I had truly no idea. We can push early onset dementia by 9 years if people have great spaces of socialization. There's a lot of mental health and social well-being factors that can be significantly improved if there's great spaces of socialization. And I don't mean a little meeting room tucked in the basement of a building. Environments that are truly conducive for people to gather and engage with each other. When there's great spaces of socialization, you catch, the isolation of seniors, which is a downward spiral, right? The rates of suicidal teenagers decreases. All kinds of positive outcomes happen. So this is a really important one to be addressing in plans and designs is, are we in fact creating great, positive, engaging spaces of socialization? And it doesn't matter if you're doing a tenant improvement in a tiny little building, or if you're doing a big, massive neighborhood plan. It's a critical question to be asking. The second domain is the environmental domain. And the first indicator here is delight and enjoyment. Clearly, if people are not enjoying their environments and they don't find delight in it, it's not going to contribute to their mental health and their overall sense of well-being. So some of the metrics in here are, for example, access to natural light, access to natural ventilation, views to nature. We know that we can increase significantly the quality of life of people, not life expectancy, but quality of life, if we have views to nature from environments where people spend more than 4 hours a day. These things are well documented. So we need to be able to bring that into projects and have these conversations with communities. The second indicator is, of course, all the things that are typically tracked in an environmental domain. The health of natural systems, because these are intricately linked to the health of communities. So energy, water, greenhouse gases, carbon, these things need to be considered in a wholesome kind of a way. Third indicator here is mobility. And I talked earlier about active lifestyle. So two things that are tracked here is active lifestyles and reduced car dependency. And you'll notice a lot of the literature is very much focused around this particular indicator. And that's a really important one. But again, if this was all there was, we wouldn't need to be thinking about all the other considerations. The last indicator here is resilience. And this, I will invite people to think about this in a broad sense, because when we think about resilience, we often think about floods or fires or big catastrophic events. But in fact, we as individuals, as families, as communities are facing change on a constant basis. We need to have the ability to adapt and to be in a good position at the other side of change. And I'll give you an example. We're all aging, right? And but how many of our environments are actually designed for us to age in place? This is a change that we know is coming. It's something that we know is happening, and yet we kind of ignore it and we don't often design for it. So we need to anticipate changes in demographics, changes in economy, changes in technology, changes in our own households, scales and sizes and compositions, and start to really anticipate this and be able to build resilience and adaptability as we continue to move forward in our environments. The third domain is the economic domain. And the first indicator here is affordability. And I'll invite you, we most often think about affordable housing, which is really important. But I'll invite you to think about all aspects of sustaining your lifestyle. So affordable transportation or affordable access to recreation, right? Or other aspects of where household incomes are going. And I'll give you an example. The average Canadian will spend 17% of their household income over their lifetime on housing, but they'll actually spend 14% on transportation. So if I can enable somebody to live without a car, I've just liberated 14% of their household income and allow them to spend it on housing or on recreation or any other aspect. So we need to be thinking about all things that we can be thinking about in terms of affordability. And many projects might not be able to develop affordable housing, but they may be able to contribute to other aspects of affordability. Second indicator here is complete communities. And this is the idea that scale matters. If people are able to do all of these things within walking distance, then many positives come around it, right? If a kid can walk to school, or if I can go to the grocery store and buy milk, if I can engage within a walking distance, then active lifestyles, but also socialization and many other things start to come together. And if scale matters, time also matters, right? So really thinking about the life cycle costing of things, which means not just thinking about the capital cost, but also the operating cost, the management cost, even the disposition cost of elements, and really starting to bring those into the bigger perspective. The last indicator here is, of course, the local economy. Because if I can spend $1 and have that dollar spin around the local economy, we know that one of the social determinants of health is income. So if I can make contributions to the health of that local economy, I'm going to be able to significantly impact in a positive way the health and well-being of that community. So are we hiring local talent? Are we creating opportunities for local entrepreneurialism? Am I creating opportunities for startup businesses? You know, all of these things will have a significant impact. The fourth domain is cultural domain. First indicator here is access to cultural and recreational vitality. And this is not just access to the big institutions, the museums, the galleries, right? This is about finding yourself represented in the environment, right? Being able to understand local culture, being able to understand the nuances and the relationships and the identity that you have within it. And I'll give you an example. I was standing once on a university campus and with a student who was an Indigenous student, and he was telling me that looking around, there was nothing that represented his culture, and he couldn't see himself represented in any aspect of it. He had actually grown up in that city, and it was a huge part of that city, and yet could not find access to the culture that he identified and felt alienated in his own city, in his own university. We need to be addressing this. We need to be asking communities as we start many of these projects, you know, what are some of the cultural markers? What is the identity that needs to be expressed and flourish and brought forward through our projects? Because this is really important to that sense of belonging, right? To people being able to feel like they actually belong to those spaces and those communities, and they're part of it, and they're a positive contribution to it. Imagine what it does to your mental health or the natural and support systems that people build at a social level if they have no sense of belonging. So some of the metrics here are rates of volunteerism, right? Or how many of your neighbors do you know? Because we know that in communities where there's really strong rates of volunteerism, they're more resilient. That senior gets caught, when health starts to deteriorate and they don't, spiral out of control. And the social capital that gets built in these environments enable people to have some of the support systems that they do need. So the more that we can actually ask in projects, how do we create opportunities for volunteerism? How do we enhance a sense of belonging? It becomes a really important element. Third indicator here is play. And this is one where I love that literature is just continuing to increase how the ability for people to engage with their environments in a playful and a creative manner. And this is not just children, it's all of us, right? Has a huge positive contribution to mental health and social well-being and many other aspects. And the last indicator here is learning. And this is not just lifelong learning, but this is the ability for people to understand why all of this matters. Because if we just go around wagging our finger and saying, they should lead more active lifestyles, but they don't understand why, it's never going to happen. So how are we actually building capacity and understanding through our process, through our designs, for people to participate in an intelligent and active and strong way? The last domain is the political domain. And I love this photo because we were doing engagement in the Jack Layton Ferry Terminal in Toronto, and Batman and the Joker took time from taking photos for tourists to come and engage on our panels. But the first indicator here is an integrated process. Did we actually have all of those voices that are key to participate from day one, right? Or did we call the landscape architect at the end of the project, right? Did people from the community have the ability to participate? Did we actually create a thought exercise that integrated a diversity of voices from day one? Second indicator is collaborative. Just because they were there, did we actually create an environment that was safe for them to participate, right? Where their voices and their contributions were significantly considered and they became part of the exercise. And this is really important to this last one, which is instilling a sense of ownership and stewardship. We know that in those environments where communities and members of a building or a residential organization have a strong sense of ownership, they're looking out for each other. We're building some of that social capital and they engage in those environments. And I'll give you an example. In our prisons, we actually don't let people, paint walls or change things around, and because we've decided that's a way of penalizing folks. In our homes, presumably we can do that. But in our open spaces, in our sidewalks, in our parks, we actually don't allow people to make interventions, to change things up and to play with things. We're treating citizens in public environments in the same way as we treat prisoners in prisons. We seriously need to be thinking about this. Sometimes simple things like having movable chairs in a park can make a huge difference, because it allows people to now craft their environments in different ways and engage them in different ways and really be able to own up and be a little bit more stewards of their own environments. So you may be thinking at this point is like, this sounds awesome, but how the hell do I implement this in my life and my work and my projects? Sounds very theoretical. Well, frankly, we've just been taking it out and talking to anybody who will talk to us about it. This is an example in the city of Kingston, North Kingstown, which is just north of the downtown, and engaging communities and asking them literally, how do we increase a sense of belonging? How do we create opportunities for volunteerism? How do we create environments for socialization? And guess what? Communities actually have some great ideas. So, you see on these panels, there was an actual people tracking all of the different ways in which these indicators could be affected in a positive way, and that resulted in the actual plan. This is an example in the city of Ottawa, where you can actually see people using these wheels to be able to have those conversations. And again, it resulted in the development of a plan and the design for the neighborhood, for the development, that was actually improving on all of these different indicators in a positive way. This is an example in Vancouver with Vancouver Community College, which was also rethinking how their locations and their sites could be brought about. And as a result of this, they actually flipped their campuses and they became open to the community and engaging, and did it in a very positive kind of a way. Site, bring it down to a single site. This is an example in Toronto where a single tower was starting to think about how they could contribute to well-being. Or in San Francisco, this one I love because she's using the little wheel as a fan to kind of, as the same time as everybody is having this extremely serious conversation. This one I also loved because folks decided to dress themselves up with the different colors. So you see all the different facilitators representing the different domains, and just having a big conversation around how their thought process and their engagement could actually facilitate delivering well-being in the community. And of course, much of it is happening these days in virtual environments, and it's the same conversation that we can have. Or even this one, somebody sent me, they were doing some site assessments and they started to track and the community to kind of numerically start to identify their understanding around some of these things. It almost doesn't matter how you do it. It's the question of being able to do it and to have these conversations and to be able to advance the thinking in positive ways. But I want to end more or less where I began. And these are the photographs of my great-grandmother, my grandmother, and my mom. This is me a few years ago, and this is now my son. So 100 years ago today, but actually let's start thinking about the next 100 years. How are we going to be creating environments that the next generations are going to be living with, that are actually going to be contributing to their health and their well-being? So all of this research, by the way, is freely available. You can go to the Conference Board of Canada's website. There's a link there where you can find all of the information and be able to see the indicators and the metrics and use them. Let me know. I'd love to hear stories around how people are using it in different environments and how they're being deployed and the types of conversations that people are having. I think it's very positive if this knowledge is actually permeating and having an influence in how people are thinking about their environments. But I'll pause here and I can post this on the chat if people like, and open it up and see if there's any thoughts, any comments, any questions that anyone might have.
Thank you very much. I think that was really great and really gave us some good, I think, questions that we should all be asking as we take a hard look at how we live in our cities, especially in light of the pandemic. We have the first question is just on commenting on trends in community engagement. Are you seeing any growth in general? Individuals who are active in their neighborhood associations are often engaged, but what about people who are not really aware, people who are living in cities but are not necessarily already kind of like thinking about these questions?
Yeah, really, really important question. Thanks to, I think Eleanor asked it. One of the interesting things that has happened during the pandemic is, of course, all the forms of engagement. We're doing this webinar now entirely virtually, right? Have actually needed to be rethought. And at the beginning, it was seen as a huge problem. But I've actually seen a reinvention of a lot of modes of engagement that have created opportunities for folks who previously were really hard to reach or did not engage in other ways. So on open houses today, I'll see, the single mom with 3 kids running in the background as she might be preparing dinner. It would have been impossible to go into an open house in a church basement, take the time and, find childcare and all of these kinds of things. or people who are, in a wheelchair. Now it's just as easy to participate in an open house, or folks who are on the autism spectrum, right? And would rather be in a very controlled environment. So all of a sudden, through virtual tools and mechanisms, we're starting to see the participation, the opening up of opportunities for folks who might not have participated in the past. So that's really encouraging. But it's still the case that inevitably there's voices out there that are really hard to reach. And there's all kinds of ways in which we can try and do that. Going out to them, putting up the pop-up session, right? That photograph in the ferry terminal, going out to people where people are, it's really important. And then there's people who we will never be able to reach. And I'll give you an example. Future generations. They're just not here for us to talk about. So we've done fun things like designate people in an open house to be the voices of future generations, or to be the voice of the animal kingdom. And of course, it's a little bit of a tongue-in-cheek type of an exercise, but it's fascinating to see what it does to somebody who, might have come into an event thinking traffic, density, parking, and all of a sudden they get assigned to be the voice of the animal kingdom. They start to kind of think about different things, or to be the voice of future generations. So there's a lot of creativity, I think, right now, and the need of reinventing some of our engagement systems that is allowing much of this conversation. But the powerful thing from the community wellbeing framework side of things is that it provides a different language and a different set of questions that can facilitate those conversations. Because for years and years, I was going to events and people are always talking about height, density, parking, traffic, right? And you walk in the door and that's always the case. And there will continue to be those conversations needed. But now we can talk about rates of volunteerism and sense of belonging and spaces of socialization. So we can change the conversation and bring it back to first principles and talk about things that meaningfully contribute to well-being and enable a more productive conversation in that way. We can talk on engagement systems forever, but I don't know if Eleanor, that expanded a little bit on your question. I see a couple of other questions have popped up. How do we move the needle politically? It seems like there's apathy for voting. Some cities not meeting their climate goals. So really important, right? Like how do we make some of these topics rise at the level of public policy, of governance and government, and how do we start to influence those things? Part of it is, well, we need to make a lot of noise, right? We need to make these things matter at a social level, right? And a little bit of that is happening on the climate change agenda, where you're starting to see that it's really affecting. And the good news is the discourse around well-being is getting more and more complex. I've been very encouraged to see through the pandemic things like the whole debate around, do we let people go out to parks in social distancing environments, started to think about elements of mental health. It wasn't just physical activity, but mental health was a big part of the conversation. So I do think that our social discourse is getting more and more complex around this, but we're just starting. We really need to be pushing. I'm talking about it everywhere I can, and invite others to really be pushing some of these ideas and bringing as much knowledge as we can into it. When you talk to local governments, what do you think were they considering allowing 3-bedroom units with a windowless room? Oh, interesting. Yeah, and the economics of development come into play into all of this, right? So allowing 3-bedroom units with a windowless room. I do think that, again, through the pandemic, people have reevaluated what their home environments actually mean, right? So debates like balcony, no balcony. If you just spent 2 years in lockdown and have no ability to even open a window people are starting to make very different lifestyle choices. Those 3-bedroom units with, which was really kind of a 2 with a den that turned into a 3rd one. I think people were compromising on that when they were thinking that they were actually spending too much time at home and leaving very early. But the conundrum is very much on the affordability side of things, right? When people are also have very little options around how they can live. And this is where having a serious conversation around density also really matters, right? Having a serious conversation around how do we actually value the land? How do we value development? So that the economics of a family being able to have 3 and 4-bedroom units can have a positive impact in urban environments and not get displaced further and further afield. One of, it's still a little bit insane that multi-generational housing is not allowed in many zoning bylaws, right? Our understanding of what constitutes the unit of a household continues to be extremely traditional. So environments when you have complex family households, and forget 3-bedroom units, sometimes 7 or 8 bedrooms in a complex household is just not even allowed and considered in much of our zoning. So we do need to open up that door and enable much more complex understandings.
And how does equity fit into all of this?
Yeah. Inequity. Yeah, and this is another one of those lessons learned, I think, from the pandemic. We've been having a conversation around equity for years. But now we actually have a tremendous amount of mapping and data to demonstrate that, yes, on face value, maybe the coronavirus could hit any one of us equally. In reality, there's a huge inequity of impact of the virus. Some neighborhoods were hit 10 times more than others. And it has very much to do with the income of folks, how the household sizes, access to healthcare, access to parks. So I'm hoping that, we do take some of these lessons learned clearly and have the ability to now advance city building and public policy in a way that tracks elements of equity in a more serious way. And I'm already starting to see it. One of the projects we're doing is the thermal comfort guidelines for the city of Toronto. And for the first time, there's a strong equity lens being brought into this whole exercise, right? And we're seeing, for federal government, we've been asked to bring a social lens into all of their different, their portfolio. So I'm starting to see that the question of equity and equity of access and being able to build strategies from an equity perspective is starting to happen as a much more intense conversation. Is there a case study for applying the metrics to a city or an area? Yes, there's a lot of really interesting case studies. I illustrated the one in Kingston or in Ottawa or the likes. And one of the encouraging things that I find is every environment has actually chosen to apply them in slightly different ways. And I'll give you one example that still gives me goosebumps. One group was doing a high-end restaurant, and it was an interior renovations for a high-end restaurant. And it said, that affordability indicator, there's nothing that we can do about that because, it's a high-end restaurant. Saying like, no, think about it. So they thought about it. And, after a long time, they came back and they said, you know what? We decided to make the kitchen have a space for bike racks so that the people who work in the kitchen could live without a car and be able to support their ability to arrive to work in active transportation modes. I thought that was awesome because it meant that they were really thinking this through, and what might otherwise have been an indicator that gets applied in a very different way in a different context, it actually influenced the design. It influenced the way that they think about it. So, this is starting to take effect at, big city scale planning, but also really small, intimate projects. And this is when it actually manages to change our discourse and change our way of operating that it becomes really interesting to me. Okay.
And can all of that's accessed via the website?
Yes. So I posted the link on the chat. It was also that final slide, and Alan, I don't know if
I can send it out to everyone afterwards too.
Yeah, and when the recording gets posted on the CanU website, maybe the actual link. Yep. All of this information, by the way, is absolutely free. It's accessible. People can download it and use it anywhere. And I get phone calls and I hear stories of, Montreal, and somebody called from Dubai, and like Bogota and Paris, of people using it in different ways. What is inspiring to me is when we're pushing the dial forward, right? When that conversation is actually moving in positive ways, and where people are actually making decisions and having conversations that they may not have had otherwise. Alan, I know we're down to the wire. Any other questions?
I think that's all of them. Oh, one more. Should the burden to make something like a high-end restaurant, quote unquote, work fall to the workers and them riding a bike? What if they have another job across town and children to take to school and can't bike?
Yeah, really important question, right? And in this particular context, this is the solution that they came up with. But to your point, if you were part of that conversation, those are some of the questions that you'd want to ask. I don't know that we have prescribed solutions for each one of those cases. What is interesting to me is, in this case, this is the solution that they came up with. I'll give you another example. So, town of Petrolia, they were seeing that one of the challenges that they were having was the isolation of seniors in rural communities, at the same time as seeing high suicidal rates with teenagers. So they created a little program where teenagers volunteered to drive seniors to the hospital, right, for their medical appointments. Again, awesome. They were able to, find very creative solutions that were addressing rates of volunteerism and the isolation of seniors in creative ways. That may not work in a very different community and different setting, but it's the one that worked for them in that particular context. And if they were able to advance the conversation by asking the right questions, then I find that that's incredibly inspiring. Okay.
Perfect. Thank you very much. I also just wanted to let everyone know about a TED Talk that was published just yesterday from our scientific director, just talking about some of the work that CanU's doing to make information about environmental exposures and the built environment available, including through 2 tools that we're developing with Antonio's invaluable help and advice that I think is, just another way that people can get this information and apply it to answer these really important questions that I think the Community Wellbeing Framework is, putting out there. And so thank you very much, Antonio, for your presentation. As I said, we'll follow up with a recording to everyone, as well as the resources that Antonio shared in his presentation as well.
Awesome. Well, thank you, everybody. And thank you, Alan, for orchestrating.
Have a good afternoon, everyone. Thank you very much.
Ciao.